Hi, friends. I'm Dr. Lauren Poindexter, and we are presenting today a lovely topic on behalf of the Women in Leadership Lead group associated with the American Medical Society for Sports Medicine. I have two panelists with me, Dr. Theresa Wyrick and Dr. Alfy Olufade. We are going to be discussing career coaching for young medical professionals. For those who have joined us, I would love for you to type into the chat where you are coming from and what your level of training is. So, for example, I'm coming from Fayetteville, Arkansas. I am an attending physician. I'm a few years out of fellowship. And both Dr. Wyrick and Dr. Olufade are also attending physicians, and we will be hearing more from them in just a bit. So to get started, why is career coaching important? Well, first of all, education, as we know it, is the most powerful weapon with which we can use to change the world, and that's from Nelson Mandela. Our panelists are going to discuss their unique backgrounds and their approaches to career coaching. So what we want to discuss tonight is, why would someone want to be engaged in career coaching or be the recipient of career coaching? Who serves as a career coach and or who would benefit from it? And also, how do you go about participating in career coaching? How might you find somebody who can mentor you professionally? And then also, practically speaking, what does that look like to be engaged in a mentorship relationship? So for those of you who are joining us, thank you so much. We see where everyone is coming from. We have people from all over the United States and all different levels of training, which is fantastic. So based on your level of training, I want each of you to type into the chat, what is an important piece of information that you would like to receive from a mentor or a career coach? Okay, so none of us have all of the answers to everything that we don't understand about the system, about where we are in our training. How do we achieve work-life balance? What comes next? So Dr. Wyrick speaks a lot in our organization about promotion and tenure. So if you see the words P and T, do you even know what P and T stands for, right? So a lot of us have questions, and I want to see our recipients today, or our attendees today. What is one question that you have that you think a career coach or a mentor could help you with? And if you could just throw that into the chat, it will be really interesting for all of the attendees this evening to see what kind of questions others have. So if you see this mirror icon on any of our future slides, that's going to be a prompt to get you engaged in our chat. All right. So some of us are early on in our careers, whether you're a resident, whether you're a fellow, or you're newly graduated. In some ways, we're all beginners, right? Even if we are far advanced in our career, in our profession, maybe we're just starting to think about retirement. Okay, so retirement may be a new concept for some people. So those of us who are just beginning in our careers, we have so much to learn, and mentorship and professional coaching can be of great assistance. Another great reason to seek out a career coach is understanding the system within which you work. Maybe you're new to a community, or you're new to a medical system. Up here in Fayetteville, Arkansas, I function within three really important realms. I'm at the University of Arkansas, the research and the teaching institution. I'm at the University of Arkansas for medical sciences, where I see my adult patients. And then I'm also seeing patients at Arkansas Children's Northwest. So those are three very different systems that all have different hierarchies and different modes of communication. Okay, so maybe you need somebody to help you better understand how to work within your system. Another reason you might seek out a career coach is to achieve some type of work-life balance, or understanding, how can I better balance out my daily schedule? How can I organize patients in a meaningful and realistic manner throughout my day? How can I help organize my staff? How can I reprioritize my current priorities? And that could be really important too. If you're going from one level to another, or as I mentioned earlier, promotion and tenure, or P&T, that is when you're essentially leveling up. So going from an associate, or excuse me, going from, Theresa, correct me if I'm wrong, going from assistant to associate professor, is that correct? Yes. And then even moving up the ranks further. So if you want to graduate, so to speak, to another level within your professional hierarchy, you need to put together a packet of information that achieves certain goals, that satisfy the requirements of your institution. And so you will need a mentor to help you progress through that P&T process. Okay, and last but not least, as I mentioned, retirement. Um, you may have experienced an amazing multi-decade career in medicine, or you may be transitioning to something new, either within or outside of medicine. Anytime we undergo big life transitions, it's always important to seek out mentorship and counseling. There's a wonderful article I found on Forbes, and I also want to encourage you to look into some of the business-minded resources. They have really great advice when it comes to career management and career insights. So Harvard Business Review and Forbes are two great resources that I utilize. But this is a wonderful article, and this author made some really great statements. And one of the things she said was, simply put, no matter where you are, you don't need to, nor should you, go it alone. And also, you get as much out of mentorship as you put in. And I'm sure that doctors Wyrick and Olufade could attest to that today. Henry Ford once said, whether you think you can or whether you think you can't, you're right. And I think one of the most wonderful things that I found with career coaching is defining obstacles I faced and having somebody who understands the system help me strategize on how to overcome those obstacles, right? But don't give up on yourself, and don't give up on a situation until you have a second set of eyes looking at that with you. So who can be a career coach? And again, we see this mirror icon. So for those of you who are joining us, I would love for you to chat with us, like put something, a few comments or a few words into the chat. Who has served as a good career coach for you? So it may be your residency program director. It may be your fellowship program coordinator. Sometimes it's a really experienced nurse on the floor who is able to help you best navigate this system, right? So for those of you joining us again, if you would comment, who has been a good career coach for you? And as I went, and I did not mention earlier, Doctors Amy Hampole and Caitlin Mooney are also going to be joining us this evening. They are also on the Early Career Blueprint Series speaker panel, and they will be assisting if anybody has issues or if you're commenting in the chat, they'll be responding to your questions as well. So who can be a career coach? Tonight we have Doctors Wyrick and Olufade who are going to talk about their backgrounds in career coaching, but also it may be somebody within your system or somebody within your community. Also, I want you to consider somebody outside of your own department can also be a wonderful coach, because they may have some unique viewpoints and they may have that distance to provide some objective or some clarification, especially with regards to just general viewpoints. All right, so how does career coaching work? So it can be something as simple as meeting a like-minded coworker for coffee. It could also be a formal career coach that you seek through a formal connection. So the American Academy of Family Physicians actually has a really fantastic website where you can check out their, what do I want to say? They've got a wonderful website where a number of physicians and a number of career coaches have actually made their profiles known to the AAFP membership, and you can seek out input from those individuals. Some charge, some don't charge. So just understand that there may be career coaches out there that will charge for their services. Interestingly enough, this article that was published in family practice management. This is from Dr. Greenewald, who is my Dean of Student Affairs in medical school. And it's fascinating to see him also being able to give his incredible advice on the national stage. So he had a wonderful article here about the power of coaching and what we can do and how to go about coaching or receiving coaching advice in a practical sense. And one of the things he wrote that I thought was fascinating was that we want to learn from our past experiences and we want to actively explore how our own unique identity and how our strengths can help us overcome current challenges. So I mentioned before, one of the great reasons we can seek out a career coach is to help us better identify, define, and overcome challenges, possibly in the workplace. What we want to do together is we want to provide a vision for our future. This article actually has journal assignments included, so if you're interested in checking this out later, please feel free. Something else that this article included was a GROW or GROW model. So when you engage in career coaching or mentorship, you want to have specific, meaningful conversations that assist you in moving forward in a practical manner. And so you can use this as a guide in your own career coaching and mentorship. So what is your goal? Where are you now and where you want to be? All right. How can I get there? What are all the different avenues that I can take to get to achieve my goals? And maybe we need to break it down into short-term goals and long-term goals. Okay. How do we move forward? What's the right way to go? What are some alternatives for moving forward? Right. So if plan A doesn't work, what might plan B, C, and D look like? Okay. And so Dr. Greenewald has actually mentioned that in this article that he's expanded the GROW model to include a model called GROOVE. So setting a goal, identifying our current reality. What are my options? What are my obstacles? How do we visualize next steps? And then going forward and actually executing those steps. So once again, how does it work? So is this just getting coffee with a like-minded individual or somebody at work that you see as a mentor? Is this meeting on Zoom? Or is it meeting in the office? So all of those are great options, but need to be defined ahead of time as well as expectations. It's always important to go into any meeting having an agenda and sharing that agenda with the person that you're going to be meeting. So you want to have maybe one or two or three specific topics so you don't wind up just devolving into a conversation about your favorite dogs. That would be me. And then while you're talking, you want to take notes. So what information is being shared with you that is actionable? And after the meeting is over, you want to summarize those notes. One of the things I like to do after I would meet with Dr. Wyrick, who served as my professional coach, what I would do is I would summarize what we discussed and I would also write out my own to-dos. So I would say, before we talk next time, this is what I'm going to tackle. And I would keep that to-do list next to my computer. All right. And then last but not least, making a checklist, making it meaningful to you. And I don't mean like an item on your checklist should not be like increase salary or increase RVUs. That's not like a very clear, clean cut to do item. It needs to be something very specific, like talk to this individual about updating my online bio. Okay, that was one of my personal to-do lists. So if you make a to-do list and you can physically check off those things, that's going to help keep you on track. Also, studies have shown that individuals who make to-do lists or checklists like this are actually more likely to achieve their goals. All right, so once you've met some of those to-do lists and you've already defined a time that you want to circle back and meet again with your mentor or your coach, then let them know, how did you do with your to-do list? You can even prep them ahead of time with an email, letting them know how things went for you and some updates or some things you would like to talk about in your next meeting. All right. So let's go ahead. I'm going to introduce our presenters now, our panelists. They're each going to share a short presentation with you. And then we would really like our attendees to provide us with questions that we can ask for our panelists. So first, Dr. Theresa Wyrick. Photos on the left. She's an orthopedic hand surgeon and vice chair of the orthopedics department at the University of Arkansas for Medical Sciences. She's held the vice chair position for the last 10 years. She practices adult and pediatric hand surgery and has won numerous teaching awards. She recently obtained a certificate in motivational interviewing and is certified in the fundamentals of healthcare peer coaching through the Physician Coaching Institute. She's married to David Glover and has 2 daughters. How I met Theresa was because she sent out a department-wide email to the Department of Orthopedics and offered her coaching services. I was new to my faculty position, and I thought that this would be a wonderful opportunity to have her help me tackle some systems issues. So she is going to present first, but I will also introduce Dr. Olufade. He is a PM&R specialized sports medicine physician and assistant professor of orthopedics at Emory School of Medicine. He provides medical care for several athletic teams and organizations, including U.S. Soccer, the Atlanta Hawks, Atlanta Dream, Atlanta Vibe, College Park Skyhawks, Emory University, and local high schools. He's actively involved in the American Medical Society for Sports Medicine, where he serves as a leader in multiple committees. And I promise I am not a stalker of either of these. I'm just a huge fan. So thankful that we have both of these physicians here with us today. And then Dr. Wyrick, if you want to start screen sharing, I will turn this off.
All right, thank you. Well, thank you, Lauren. I really appreciate that introduction, and I appreciate the opportunity to know you and work with you. I found it to be a pleasure, and I also appreciate the invitation to be involved tonight. So this is kind of what we're going to do over the course of the next 10 minutes or so. I'll tell you a little bit about my background only as it relates to the topic tonight. And I'll talk about coaching and then motivational interviewing and kind of the differences between those and how I use those in my roles within the department and within the College of Medicine. So I'm a native of Arkansas. I went to medical school at UAMS in Arkansas and did my orthopedic residency there, and then went on to do a hand fellowship at Thomas Jefferson in Philadelphia. And I've been in academic practice in Arkansas, both at the Children's Hospital and the Adult Hospital now for 15 years. And I've started as the only hand surgeon covering these hospitals, and have trained and built a very comprehensive hand and upper extremity section that now has 6 hand surgeons. And we do brachial plexus all the way down to fingertips, free muscle transfers, et cetera. So a very comprehensive service, which draws and takes care of complicated problems within the region, which I'm really proud of that. The other thing I'm very proud of is that I'm married and have 2 girls. They're 10 and 13. So basically, when I came back to, I took a job at the place where I trained, and fortunately that has worked out wonderfully for me. There are pros and cons to that, of course, but when I came in and took a job there, I was kind of the first person who had joined the group in a long time. It was a small group. There were only about 12 faculty. And it was very sort of senior heavy. So I was kind of the new person, the young person. And with that, I think came new energy, fresh ideas. And I think that really infused the group and brought some enthusiasm and some energy to the group. And so, people would give me a job and I would complete it and do a good job with it, whatever that might be, from the standpoint of being the epic champion to develop our EMR, or being the medical director of the clinic. Just kind of whatever job I was given, I would do it and do it well and enthusiastically and in a timely way. And so I think if you do those things, then you start getting more jobs to do. And so I never really had the idea that I would be involved in coaching or leadership or any of those sorts of things. My goal was, first to be a pediatrician, which didn't turn out to be the thing that I wanted to do when I fell in love with orthopedics. But my goal was to become an orthopedic surgeon and to just take good care of patients and work in my home state of Arkansas. I didn't really have any goals or aspirations to do anything beyond that. Those sort of emerged as I dipped my toe in the water and then got more involved in leadership. So at the time in 2014, we had a new chair who came. He came from private practice, but had a very academic sort of mindset, very research heavy, but also very clinically productive. And so with that transition in leadership came the opportunity for me to become his vice chair. And it came at an interesting time. So my daughter just turned 10, my youngest daughter, and I was at home on maternity leave, and I was like feeding her a bottle, and Lowry called and said, "I'm going to come over and be chair. Will you be my vice chair?" And so I sort of looked at the baby that I was feeding and said, "Sure, why not?" So it was kind of an interesting time to say yes to a really big job, but it has been just the most wonderful thing because I've really gotten more involved with leadership at a higher and more formal level, and have been the vice chair since then, as Lauren said. So since then, under his leadership, the department, I think, we're close to 60 people now between the two campuses. So 12 to 60 is a really big growth of a department within 10 years under his leadership. So I got to learn a lot about how to grow and how to push people to become more clinically busy, how to become more efficient, how to manage interpersonal issues with growth, and sat in on a lot of meetings with the chair and with my colleagues when things were going well or things weren't going well, and was kind of involved in that. So it was really helpful for me to see a way to manage things, a way to grow, a way to deal with these interpersonal things or business decisions. And so I really thought that that was something that I had an aptitude for and would have a real desire to become more involved with. And so then I had the opportunity to, we had a retirement of a longtime chief of pediatric orthopedics. And so I stepped in and did that interim chief role for about a year and a half and helped recruit and hire, I guess I would say, talk our current chief into, into taking the job. I also served as the president of the Arkansas Orthopedic Society, which, as you might guess, is a group of mostly men. And our meetings are always at the duck club, which I don't duck hunt, but it's a very sort of boys network. They're all very good friends and my colleagues, but I think it was a real honor that they elected me to become president of the organization. I was honored to do that for a couple of years. And then as our department has grown, our leadership structure the vice chair structure has sort of been parceled out into different areas. And we have a vice chair of research, of education, of quality, and then of faculty affairs and development. And what really fit me best and what I was interested in was really the faculty affairs and faculty development portion of it. And it took me a while to figure out that that's what I liked. It was trying a little bit of everything. Being the medical director of the clinic, that was okay. That was more operational HR. That wasn't my favorite thing, but I tried it and figured that out. But ultimately figured out that faculty affairs and development is what I really enjoyed doing. And so as I sort of went along in my practice and became sort of more mid-career, I got interested in trying to use a different part of my brain other than just clinical work and research work, and trying to figure out how I could do that at a more broad level. So I started looking for jobs. And I had never really looked at jobs before, but what I mean is jobs within the institution. And so if you kind of look, you see, oh, well, here's a new assistant dean position that's been created, or here's someone who's taken a job elsewhere and there's a vacancy for this position. And so I started reading those rather than just quickly deleting them as I used to do, and found one that really just fit exactly what I was wanting to do. And that's the assistant dean for faculty affairs within the College of Medicine. So it was doing the faculty affairs and development job, but at a more broad level, not just within the department. And allowed me to work with other assistant deans and associate deans, and also the dean of the college. And I think that those are all very important connections to make. And so as I took that job, I knew that part of what I would do would be promotion and tenure, but part of what I would do would be dealing with problem faculty, actually. Not to say that that's how Lauren and I met, because you already heard how we met, but we have a system that's called iSafe. It was previously called Illumine. You may have something like that at your institution, where anyone can put in a complaint about a faculty member. And if it's a professionalism issue, then it comes to me to review. And it's within any department within the College of Medicine. And so every one of those, I'm responsible for reviewing and contacting the physician, interviewing the person who put in the report, maybe talking to the person's department chair, putting out feelers to see if there is something that involves other nursing staff or might involve interactions with residents or medical students, if this is an isolated thing or a more broad-reaching thing. And then I would have what is sometimes a very uncomfortable conversation with a colleague that I may or may not know about this report that they had and see how we could sort of correct that. And so that made me obviously think about the idea of coaching and how that could be helpful. But as I did research, I figured out that yes, coaching is helpful, but strictly in the sense of coaching, coaching is not for problem individuals. It's for nurturing the growth and advancement of people who are already motivated and doing well. And so I think there is a real distinction in between the idea of coaching and the concept of motivational interviewing and how that can work in this situation. So I decided to, as I sort of went through this role, I and wanted to get the most preparation as I could for being the best at this role in faculty affairs and faculty development. I approached the dean and said, I would like to work on getting experience in coaching and certification in coaching, but I also think that this course in motivational interviewing that I found would be really great for my job as well. And this is why. And so I just pitched it to her and she said, we'll pay for it. And so that was really fortunate, but it took some research and asking questions and figuring out what I wanted to do, looking at what the cost would be and the feasibility of me actually doing these things, and then how I could use those and just making the pitch to the person who could write the check and say, yeah, we'll pay for this. So the Physician Coaching Institute is the one that I did my work through, and it was a healthcare peer coaching fundamentals course. It's certified by the International Coaches Federation. There are lots of different things if you start looking for coaches that are out there in the medical field, but I think the ICF is the one that seems to be sort of the most respected and kind of uniform throughout the coaching, medical coaching sort of world. It was a 2-day virtual course on the weekend. I think it was about $2,000 at the time. It was an all-day course both days, and you're in a cohort of other people who are taking the course with you, all physicians, kind of going through this fundamentals course. So basically, as we said, coaching is distinct in that you're partnering with people to sort of go through this thought-provoking and creative process that's really meant to help them hone in on their personal and professional potential. So you're helping people who are already great and already motivated be better by focusing in on their strengths and helping them sort of spend time fleshing that out. Coaching is not therapy. It's technically not mentoring. It's not advising. It's not telling people what they should be doing. It's not telling them how to practice medicine. So it really is kind of a distinct area. And I think I've been able to really use those skills in my role, in both of my roles within the department and the College of Medicine. So motivational interviewing, or MI, is something that you may have learned about briefly in medical school. I never learned about it in residency. You might guess surgeons don't do a lot of motivational interviewing with their patients. We kind of show them the x-ray and tell them what we think should be done. But basically, it's a method of communication for exploring and resolving ambivalence. And so it's talked about a lot in like substance abuse, alcoholism, things of that nature. But it can be expanded to getting your teenager to do their homework, or, not sneak out at night, or these sorts of things. So the conversation and the technique can be expanded in lots of different ways. But basically, the thought is that people's default is to be passive or to be ambivalent, to not really make a change, to do the status quo, because that's what's easy, that's what we know. And so in my job in faculty affairs, in this case, I have to have a conversation with someone who is having a professionalism problem or professionalism issue. So I need to figure out a way to help them be motivated to change because we have to initiate better behavior. The stages of change are really kind of, I'm not really even thinking about it. So pre-contemplation, and that's generally where I hit them, as you might guess, when I cold call them and say, hey, I've gotten this report on you and this is what it says. So that's kind of where I hit them, is that pre-contemplation stage. And then when we meet, it's my goal to help them get to understanding where the problem is, thinking about changing, why they might change, and then starting to sort of make a list of how they might change, prepare, and then create those steps of action. And so that's kind of how I thought the MI process would really work for my job in faculty affairs and dealing with these kind of professionalism issues that come up. So the course that I did was through UMass. It's an online course. I did it in the spring of 2022. So there are 10 hours of lessons, and those are kind of done on a schedule, but you can do them on your own time. And then there are 5 virtual real-time learning labs, so an additional 10 hours that you do, again, with a cohort of various individuals who are going through this course at the same time. And then you have 2 acting patient encounters that you set up with an acting patient to practice your skills. One in the beginning when you're very green and don't really know as much about what you're doing. And then you get a feedback session. And then you learn more about how to hone your skills on the technique. And then you do a final kind of acting patient encounter and another feedback session with a certified coach for the course. And so it helps you really try it when you're really green and don't necessarily know what you're doing, learn about it, and then try it again and see how you can improve and get some feedback on that. The cost was about $1,700 to do it. So, both are pretty reasonable from the standpoint of an investment. And so, as I said, with my personal experiences, I sort of have 2 buckets of activity. One is working with great, motivated, highly functioning individuals like Lauren, who just really need someone to kind of spend some time and ask questions and listen and focus. And then the other is kind of, as I talked about, kind of people, colleagues who I may or may not know or have met before, who are having professionalism issues that are reaching the College of Medicine office, and then having that conversation to try and get them to think about changing, and then how do we take the steps to improve your behavior. And so as I was kind of thinking about this, I do agree with some of the things that were already said, that it's important to, from a coaching standpoint, it's important to have some really specific things that you want to talk about if you're going to meet with a coach. So examples of that, so I did send out an email to my colleagues and said, hey, I'm certified in these kind of techniques and coaching, and obviously free of charge and totally confidentially. If you would like my help and would be interested in, exploring the use of a coach, and if that could be helpful for you, please let me know. And so I had 4 or 5 people who took me up on it, and I've continued to meet with them. And so I think from a coaching standpoint and from a coachee standpoint, having 30 to 45 minutes of time is really best. It takes about that long to kind of flesh out the whole question and then really think about answers and checklists and things that you might do. So it's not really something that's like a 5-minute, hey, let's talk about this sort of thing. If you really want to have a good coaching session, you both need to set aside 30 to 45 minutes to really sort of focus in on it. And I think it's one of those things that you have to set aside that time, and you can't just leave a meeting that is going to be very stressful and then walk right into your coaching session, whether you're the coach or the coachee, because you won't be in the right place to really listen, to really learn, to really think. You'll still be rolling around about this very stressful thing that just happened. So the time really needs to be for you both to focus and concentrate fully on what it is that you're doing. I think it's best to bring one question or one topic that you want to explore. And sometimes people bring a very broad topic, and we narrow that down to say, okay, we only have 30 minutes. Let's narrow that down to what's most important. Or sometimes they bring a very specific topic. So examples, I had someone who said, I have a specific job opportunity as a director in the operating room that I'm trying to decide whether or not I want to take that job opportunity. So that's a very specific question. And we flesh that out, pros and cons, opportunities for 30, 45 minutes to really figure out what's the best answer to that question. Or I have an interpersonal conflict with someone who I work with. And so let's talk about that. Or more broad, like I had someone who said, I want to be more involved in hospital leadership. So kind of fleshing out, what is it about leadership that you like? What things have you done? What do you see yourself doing? So it can be, those are, I think, good examples of things that are very amenable to a coaching meeting. I think it's better done in person, but can absolutely work on Zoom. I do it both ways, just depending on location. I think that it also heavily relies on a relationship of trust and confidentiality. And so we start generally when I meet with someone, I start in the beginning saying, I want you to understand this is a confidential meeting. I'm not going to tell anyone what we talked about. If you want to share with someone, you're welcome to, but my lips are sealed. This is a confidential relationship. And I think saying that from the get-go is very helpful, both with coaching and then with the motivational interviewing that I do, because it's a trust relationship, and a lot of it requires you to be pretty open, particularly as the relationship develops, to share things that you might not necessarily feel comfortable sharing, particularly if it's an interpersonal issue with someone in your group or your department. I think from the standpoint of just being a good coach and a good coachee, listening is probably the most critical thing. And so I, as the coach, have to really listen to what's being said and ask questions about those specific things. And I even take notes so that I can, when the person finishes their thought, I can say, now what I heard you say in all of that was this. That really stuck out to me. Tell me more about that. What are you thinking about that? And I think, as Lauren said, if you're the person being coached, oftentimes taking notes is very helpful. And out of that, you can say, what are my action items? And at the end, we'll often say, what are you going to do between now and the next time we meet? What's on your list? And I think that just keeps you very accountable, and it lets you get the most out of your coaching experience. Those were kind of my brief thoughts. I want to make sure we leave plenty of time for Alfy and for questions. So with that, I'll just turn it over to Alfy.
Okay, I'd like to thank you guys for showing up this evening, and I would like to especially thank Dr. Poindexter for giving me the opportunity to talk. Big shout out to the Women's and Leadership Lead for the invitation as well. When I was asked to have this conversation to talk about career coaching and young professionals, like was mentioned earlier, young professionals depends on different spheres and aspects of wherever you are in your career. It could be in high school, it could be in college, it could be in residency, fellowship, and as an attendant. So my objective is to kind of give a little bit about my background, talk a little about some of the leadership courses that I've been through in the past 11 years or so as an attendant, as well as talk about a little bit of some of the specific lessons that I learned during those times as a mentor as well as a mentee. So let's take a step back. I grew up originally from Nigeria, lived in New Jersey, went to Rutgers, as well as New Brunswick. My pre-med advisor, Dr. Kamal Khan, was very influential. Arguably, he actually has gotten the most amount of minorities to medical school nationwide. Moving on to medical school, I went to Robert Wood Johnson Medical School. Dr. Janice Johnson at the bottoms of the screen, extremely influential. Dr. Larry Chu is a PM&R physician during my third and fourth year. I remember going to his office in Philadelphia, and I said, if I could do what this guy does in 10 years from now or so, I feel completely accomplished in life. I don't want to do anything more. But I'll fast forward real quick. I saw him about 4 or 5 years ago, and I remember him talking to me. One of the things I liked about him is a straight shooter. Speaking of mentoring, counseling, motivating, all that stuff. Sometimes what sticks out is that personal touch. Me coming into his office after an hour, 7 o'clock, before he starts seeing patients, that dedication of an hour or half an hour still resonates to me 20 years after he did that. It made me want to have interest in physical medicine rehabilitation. During my residency at Temple in Philadelphia, Dr. Michael Wynick, as well as I made. Dr. Wynick was the charismatic guy, just you want to be around him. And you see some of your qualities and personalities in him. The reality is we are all not the same, and that's absolutely fine. But seeing somebody that you have similar quality and characteristics with are very important. During my fellowship in sports medicine at Crozier, Dr. David Webner was one of those guys that gave me a chance. I went to a family medicine, sports medicine program, not a PM&R-based one. And at that point in time, when I did that, that was not necessarily the norm in most places. And like I mentioned earlier, I've been a faculty at Emory for about 11 years now. And this is just a few of some of the folks that I've mentored in the past couple of years, just kind of listing a few of them. And my goal within the next 10, 12 minutes is kind of discuss some of the things that I learned from those guys that I worked with in the past, some of the things that I've seen in these mentees that I've worked with, what I thought resonated and what I thought worked. And maybe every now and then I'll mention what I think did not work as well. So I mentioned during the past 11 years, I've done a few courses at Emory. The junior faculty development course was more of an introductory type process where you could talk a little bit about promotion, talk a little about communication, talk a little about a variety of different things. Starting from 2019, I was involved in the leadership development group at the Department of Orthopedics. I also did it's called URIM, on the representative in medicine faculty development, as well as lastly in 2023, I was given a leadership role. And so my chair, Dr. Bowden, asked me to kind of go for this course, a new clinical leader course. So a lot of the pearls I'll be discussing tonight is what I've kind of gotten, like I said, also from these courses. So I would probably be highlighting a couple of slides on this: communication, time management, meeting skills, mentorship, promotion, and social media. So let's start with communication. Like it's been said, oftentimes when you meet somebody, they are very quick to judge you and have the impression of what they think of you within the first few seconds. So when you're having this conversation of communication, or you plan on having a meeting with somebody, be prepared, do a little bit of the due diligence. Oftentimes people talk over other folks. This act of active listening, just listen, not to respond, just listen to listen. I was walking, I was doing some procedures today. I walked by one of the surgical techs, and I remember he was complaining about another leader. He said she didn't have empathy. She just wanted to listen to me talk. So regardless of how much we think we have a poker face, people will see through us. There's just that feeling of empathy, that feeling that Dr. Larry Chu took 30 minutes before each clinic day and 30 minutes after each clinic day, and just talking. That's extremely important, and people see that. And a lot of time, actually the bottom one, is there anything I could do for you? As human beings, we're not used to people asking that question. So if you want to get to know somebody, you want to get to be on the good side, you want to kind of a rapport, a relationship with them. When you phrase words like that, or when you have those strategies of communication, it's extremely important. And because we all come from diverse society, either from social, economic, or even generational, it's important to know the way we come to this framework is because of the changes or differences that we have. The second thing I would discuss is time management. One of the problems as physicians is we work a lot of hours, we do a lot of stuff, we spread ourselves very thin, and we procrastinate sometimes. And when that happens, usually we have poor management skills, increased stress, in addition to the stress we've had, and our productivity decreases. So one of the ways to kind of work on a better construct of time management is, what is your mission? What is your goal? What is your purpose? What do you want to get accomplished? Because the reality is, when you have that mission statement, it's easier to kind of be able to say some yeses, say some nos, and be able to kind of have a proper timing and management for the ones that you really like, because that will give you better satisfaction in general as a whole. Meetings, and I'll take a step back, and I think even when you think about a medical student or a resident approaching somebody to be a mentor, for example, that communication skills is important to having that conversation. The time management is being able to take time off after your clinic post-call to go work with somebody. That's the time management that needs to happen. So how about this meeting? When you meet with that person, or when a junior faculty meets with the chair, or when a junior faculty meets with a senior chair, what should the conversation sound like? And this has some things to do with academic medicine, but not always. Some of this pertains to private practice people as well, too. So let's first talk about the private practice, the general conversation, or even if you're hosting a meeting, how do you stand out? These are some of the things to keep in mind. At the beginning of the meeting, have some clarity on your purpose and agenda, have some clarity on the process involved, and be willing and accept that to say that you're going to get some feedback from them. Come prepared. Go through your papers, go through your slides, build a trust among folks you're seeing. And oftentimes, there's always one or two folks in the room that are always quiet. Sometimes it could be just quiet-minded people. Sometimes it could be the women in the room. Sometimes it could be minorities in the room. Giving those people that are quiet an opportunity to feel comfortable, to express themselves in those types of meetings. And at the end of the meeting, making sure you have the action items that you want to summarize and take with you. So what about if it's an academic medicine? When you're talking to your chair or your director, tell them what you're passionate about. Tell them what your successes have been. Tell them a little bit about the failures that you've had. Talk a little bit about other people you've met, you've discussed, and some of the struggles they've had, or one of the things that they want to improve on. I think at any level of leadership, at any level of organization, somebody that whines is what we don't want. So just try your very best to make sure you're not that person. So far we've discussed communication skills. We've talked a little bit about time management. And most recently, we also spoken about some of the pearls and keys to have in meeting. So now let's talk about mentorship. Those 5, 6 people that are listed earlier in the first slides, they've been mentors of mine at some point in time during my career. I don't think you have to have one person. Through your journey, your mentors might change. But what did they do for me? What have they done for me? And the folks on the second slide, what do I think I've been influential and helpful with? Sometimes it's a definition of career. Some folks have a very direct path in their career. Some of us kind of, we have a little bit of thinking right, thinking left. We have other things that we have in mind. So you need somebody to help you clarify that. Some goal setting. I mentioned some of the programs that I've gotten into. There are a few of them that I actually have not gotten into. So some constructive feedback from some of my mentors telling me, Alfy, I think you should do this. Alfy, I think you should have done that a little bit different. The fourth slide is extremely important. I've been very involved in FAMSSM for the past 11 years. The first 4 or 5 years, I remember going to the meetings and having some conversations that I want to do more. I think is a few individuals in FAMSSM that just say, you know what, Alfy, it's okay, let's have you do this. Let's have you do that. So that introduction to influential people that can actually put you in different meetings, different boardrooms, different connections, different bars, different golf clubs, whatever that you like to do, different gyms, whatever you'd like to do. And lastly, but not the least, letters of recommendation is extremely important. So as it pertains to women and minorities, they actually don't mind having people that doesn't look like them. About 80 and 86% of minorities are okay with that. But oftentimes what happens is they don't get all that information that they need from that particular person. But it's okay. I tell people it's okay to have 1 or 2 mentors, but I also want to stress it's absolutely to have a mentor that does not look like you. That is okay as well too. Why is it important? Men more than women are more likely to do a lot of other extracurricular stuff outside of institutions. Women are less likely to negotiate about salaries, benefits, space, and support because for whatsoever reason, they just always don't feel comfortable doing that. And let's be clear, there's some stereotypes that different groups also have to kind of work through. Some of them might be true, but some of those stereotypes or perceptions might not be true. So it's important to kind of keep that in mind with different populations. So what's your goal? When you meet a potential mentor, you have to talk about what you're looking for. Is it more effort-based? Do you want to have an impact with something? Is it about more having visibility in one organization that you are? Or are you seeking promotion to go from instructor to assistant professor, assistant professor to associate or associate to a professor level, you want to have some ideas in terms of what you're really looking for or what you want them to do. But I think it's very important to set the guidelines, say mentorship or being a mentee is not easy. It comes with work. It's important to know that oftentimes there are opportunities to make national as well as international connections. A couple of days ago, a few of us went to a conference, international conference. It was just beautiful to kind of hang out with three of my previous fellows and just hanging out and just reminiscing about, you know, what life was been like post-residency as well as an attendance. Create developmental networks, find leadership training and other things that you might be interested in. And if you're a mentor or you've been, what I was trying to say is, even though you're mentoring somebody, understand that you've probably been a mentor of somebody else as well too. So it goes both ways. If you get some skill sets, if you're fortunate and you're in one place, it's extremely important to be able to go back and pull the next boy, pull the next girl, pull the next man or woman, and put them in the same direction as you are going. So this is one of the slides that was shared with me during one of the courses. And I think it's extremely important for each and every one of us to have this. Putting you in the middle and putting that circle around you and having those aims of what the circles are. Is it career? Is it access to opportunities? Is work-life balance, emotional support, role models, professional development skills, as well as project specific. When you're able to kind of put names and processes next to this, this allows you to have a better understanding of the path you're going and which direction you want to go to. There's a big difference between mentorship and sponsorship, and I think a lot of us do hear this. I just like this slide because it kind of clarifies the difference. A mentor helps with career development versus a sponsor career advancement. A mentor will usually more focus on that personal professional development, while a sponsor is thinking more from a career standpoint. From a relationship standpoint, it's transformative if you're a mentor because it's taking a long period of time. Versus sponsorship, it could be very transactional. It could be, I want to get promoted to assistant professor, so associate professor. And lastly, but not the least, I think they are very both critical, but depending on what phase you are in the early years, a mentor might be more important versus the latter years of that framework of where you are, a sponsor might be more important. Promotion has been mentioned earlier. I think is extremely important. Just one of the few things that I learned, keep all your correspondence. It might be the letter from a high school student that shattered you to something that somebody wrote as they got their fellowship, the evaluation forms and evaluation things that was written about you. Everything counts. The quantity counts. Don't feel like you're being redundant. I'm actually in the process of applying now, and we'll see what happens in in 18 months or so from now. But I've learned a lot from learning to those courses and speaking to some of our chairs as well as our former chairs in the orthopedic department. The trajectory you want to go matters a lot. And lastly, but not the least, the role of social media. I think this could be a divisive topic, and I think overall, the younger you are, the more social media prone you are, versus if you're a little bit older, you're not crazy about it. But in my opinion, it's about how you use it. So this is some of the pearls that I got from it. What social media allows you to do is automatically extend your network. There were about 7 or 10 people that I met at the conference that I just came from that I actually never met in person before. But just because of social media, we knew of each other, we knew what our interests were, and we were able to gather and talk and relate and come up with different ideas of what we wanted to do together. It projects your strengths. I think it gives you an avenue to show who you are, your authentic version, depending on how you use it, but at least I think that's something that you could do. It gives voice to your passion. If that's something you're strongly interested in, express it, show it. And it flattens a little bit of hierarchy. I will say we all don't come from different type of school school system, socioeconomic standard, and wide other things that we don't necessarily come from even grounds. This sometimes can allow you to flatten the hierarchy and make you an equal compared to the other person. So those are kind of my slides. I'm happy to stop and take some questions.
Thank you. That's fantastic. What I'm going to do is I am going to go back and share my last slide. So attendees, if you have specific questions, please go ahead and look into the chat. I'm going to ask Dr. Wyrick and Dr. Olufade if you guys will go through the chat, pick out maybe some comments that you've seen or some questions that have been written, and I'm going to go ahead and try to turn my slide. See if I can get it back there. There we go. Alrighty. Okay. So I'm also going to go through the chat and see.
I think one of the questions, which is a good one, is at different levels when you're sort of helping people along, as they're starting out as medical students or even college students, if you have the opportunity to mentor, really younger learners, they may not know exactly what to ask. They may not come to you with a well fleshed out topic. And so sort of advice on that. When I meet with medical students, generally it's because they're interested in orthopedics and they want to know, what they need to do, what the field is like, that sort of thing. And so I try and group the discussion into sort of some broad topics, which include academic things like class rank, test scores, goals for that, where are you and what would your goals be, or what do they need to be in order to be competitive, research goals, leadership, volunteer, sort of extracurricular type goals, and then kind of shadowing and getting experience goals. And so I sort of, when I meet with them, I just sort of divide things into those 4 groups and say, okay, let's flesh out some goals within each of these, because I think they often don't know what they don't know yet at that level.
There was a wonderful question that I would like you both to touch upon. How can our trainees best predict what type of job setting is going to be the best fit for themselves?
Yeah, I'll take that first. It's funny, when I was going through my residency, and I kind of maybe indirectly alluded to it, I actually never saw myself in academia. Actually, I was the opposite of
I'm shocked.
contrary. And because just my mindset and my exposure, what I've seen around, did not necessarily make me think I wanted to do academia. So my first lesson, what I would say is, don't shut the door or close the door 100% on anything, and just leave a little bit of flexibility. For me, I think when I ended up in academic medicine, what did it for me, the first thing was, one is kind of maybe like the camaraderie. I think amongst me and my colleagues and peers, I think we have a good, strong camaraderie that's not necessarily antagonistic. So I think that gave me a good environment of comfort, meaning as a young attendant, as a new attendant. So I'll split it into 2 and say, you could get that in academic medicine, but you can also get it in private practice as well. But make sure, if you want to go to private practice, maybe a team-oriented place where they actually like each other, they hang out with each other, the families hang out. I think that would be a good sign to say that's kind of one place that you want to go or not. And what's kind of kept me in academic medicine, like I said, it's to be frank with you, the opportunity to do what the folks from those first slide have done to me, an opportunity to pass it on. I strongly believe, regardless of how smart you think you are, each and every single one of us, we didn't make it there by ourselves. So I think that opportunity, that sense of community, that sense of ownership, that you have to kind of pass something on, I enjoyed that a lot from mentoring of high school students, college students, residents, fellows, as well as junior attendants.
I love
Yeah,
that, Dr. Wyrick.
I was just going to say, just my advice, and I think what was personally helpful for me, I didn't really know what kind of job I wanted, and didn't have a strong research interest or background. And so I didn't necessarily picture myself in an academic sort of job, but I knew regionally where I wanted to be. Little Rock was my home, and so I knew I wanted to be back in Arkansas practicing. And so since I knew that part of it, I just approached every group in the area and interviewed with each of them and asked questions and listened. And I figured out through that process of just listening and asking questions, what I really wanted out of my practice. And for me personally, it was to be able to take care of children. And from just a resources standpoint, a payer standpoint, having tertiary services to take care of sick children, really the best way for me to do that was to make sure that I was fully affiliated with the Children's Hospital. And for me, that meant being in an academic practice. But I wouldn't have known that except that I went and asked questions and interviewed and met everybody, both academic and private practice in the area. So I would encourage you to just, as Alfie said, don't close any doors and go meet people and ask questions.
You know, it's so interesting what I'd like to point out, and I think Doctors Wyrick and Olufade would agree, like what we thought we were going to be going into high school changed. What we thought we were going to be going into med school probably changed, right? What we thought we were going to do, you know, our first couple of years out of fellowship may or not be what we planned. And so our own private identities, our professional identities are going to evolve over time. And you don't have to predict accurately exactly who and what you're going to be in the next 5 years. So it's okay to pivot when it's time to pivot, right? So I think that's another reason that career coaching and also mentorship is so critical, and why we're having this conversation tonight is when it's time to pivot, no need to freeze, no need to be paralyzed, right? Reach out and recognize that there's a number of professionals out there like Doctors Wyrick and Olufade that can help you make that transition, okay? And brainstorm, write pros and cons. What is working for you now? What isn't working for you now? What type of environment would you like to be in or not like to be in? Does geography matter? Get down to the nitty-gritty, okay? And have a number of informal and formal coaches help you with that. All right, any other questions from the chat? We'll probably answer 1 or 2 more questions quickly, and then we're going to turn off the recording. So if anybody wishes to stay with us, that's great. I would like to thank Doctors Wyrick and Olufade for taking the time out of their busy schedules to be with us this evening. This was an absolutely fantastic lecture. And again, this is going to be recorded and then put on YouTube along with the other AMSSM videos. So if you are interested in, for example, how to conduct a job search, we have already presented on that topic, and you can find that on YouTube within AMSSM. All right, so let's look for some other questions. Everything seems to be, I don't know, we might have, oh, this was a good one. Dr. Hampole asked this: how do you identify people around you who could use your services, and how do you explain to them how you can help? So I'll let Dr. Wyrick go first. I learned of her coaching experience because she actually sent out an email to the entire department and offered it. And so maybe you can expand upon that, Dr. Wyrick.
Yeah, when I did my fundamentals in coaching course, they talked exactly about that technique. Just because certainly you're not going to be charging for your services initially. You're just trying to get coaching hours and experience in doing it. You know, once you learn, just like any skill, once you learn it, you have to practice it in order to get more smooth and more fluid at it and better at it. And so that's really what you need. It's beneficial to both parties. So if you're going to get training and coaching, you need to then be able to use that skill and hone that skill. And so that was one of the things they suggested. If you're in a department or you have a network of colleagues through some other organization that you're a member of, that you would feel comfortable saying, hey, I just got my fundamentals in coaching certification. I'd love to, you know, be available free of charge. It would be helpful for me. I'm hopeful it would be helpful for you. To get some experience with coaching, and people were very receptive to that. And I think, you know, particularly in some of the groups that you might be involved in, like I know the people in the department, I feel comfortable talking with them. We know all the same people. So there's a lot of familiarity that's there that I think makes that initial reaching out and then that first conversation more comfortable.
And I know from Dr. Olufade's standpoint, I mean, he is exceptionally visible within the AMSSM community. And so I bet that like people, I mean, tell me if I'm wrong, but I bet a number of people just come up to you and ask if they can, you know, share, so if you could share some of your wisdom with them. What are other ways that you've reached out to potential mentees?
I think sometimes it's just, so it's a wide range of things. So for example, I've had covering high school football games. I've had about 5 or 6 high school students kind of reach out to me with interest and just come. College, I've had, even though I grew up in New Jersey, I've had folks that have the Jersey connections reach out to me as well too. So I think it goes to just, obviously social media is also a big part of it as well too. If you're doing things on any of those avenues, I think for me, it's just being passionate about what I enjoy, expressing those passion, regardless of where I am in a high school football game versus just hanging out, at alumni type events. And definitely MSSM has been extremely important to me, and I'm passionate about it, so I talk about it a lot. And social media, those will probably be my comments on that.
Thank you. And somebody asked, when we're preparing for that first job after fellowship, or we're even thinking about that first job after fellowship, that may be a question that is asked of soon to be fellows. Like, what do we say? And I think some of the responses were great. I think it's totally appropriate when you're finishing up your residency and going into fellowship. It's completely appropriate to have an open mind, right? You can have preferences, you can have things that you're, specifically interested in. Like you would rather see non-spine patients. That's what most social or sports medicine physicians say. But do expect that you're going to be doing lots of different things, and that's a great first couple of years to figure out what you do and don't like. Um, I want to thank again Drs. Wyrick and Olufade for being here. We are going to stop recording now, and we'll see if there's any additional questions. Thank you.